Hey guys, it is good to have you here. Welcome, and I am thankful to have you. I know that there will be some that will be tuning in online, and for those who are tuning on, I want to just say thank you for joining us as well. We are going to be putting up a number for questions here in just a little bit, and so as soon as they can turn on, which I'm not sure if there we go, we got it on the main screen, excuse me. So questions for later. If you would like to text a question, just use that number, and we'll have the last 30 minutes be a Q&A time. Now, just to kind of quick do an introduction, I'm Barry Park. I'm the minister here at University Christian Church, and we're hosting this seminar on mental health for a reason. See, there are some churches who might even say that, well, you just need to fix everything with the Bible and prayer, and I'm not ever going to belittle the power of the Bible and prayer. But I will say God uses doctors and nurses and counselors just as he does churches. And so it is an important thing to press into our health that sometimes is ignored or maybe even almost shamed out of. And so I'm glad to be able to host today this seminar, and I'm going to introduce two individuals. First of all, we have Mick Tenor, and he is our Celebrate Recovery minister. He is going to give a little introduction of what that looks like, because it's one of the areas in which we as a church step into this emotional well-being and try and minister in that area as well. And then we also have Stephanie, and so Stephanie is the owner of Andrews and Associates, and so Stephanie Wick is a part of our church family. Gotten to know her recently, and she's going to be sharing a little bit as well out of her expertise, and then we'll go into the question and answer time at the end. If you, just to let you know, the bathrooms are back by the entrance, right when you walk in by the coffee bar, if anybody needs to know. And we will take a 5-minute break between the presentation and the Q&A to give you a quick break. So, Mick, would you give just a little bit of a snapshot of Celebrate Recovery for people to know? Because I know so much hope is found there and renewed there, and people sometimes just don't realize what would they expect if they come.
Yeah, thank you, Barry. I'm Mick Tenor. I'm a grateful believer in Christ, and I'm the minister at Celebrate Recovery. One of the things about Celebrate Recovery, a lot of times the name is sort of a misnomer for what goes on there. If we break that down a little bit, you know, recovery is one of the things we do daily in life. We're all recovering from some past pain, from some hurt, some hang-up, something that we have going on, some issues we've had in life over time, just recovering from just hard times, from things that just haven't went our way. So that's where that part comes from. And the reason we throw that word celebrate in there too is because, you know, it's very biblical when we do these things, but Christ wants us, God wants us to be happy. God wants us to be able to celebrate and to, enjoy life. And one of the things we have to learn how to do is we have to learn how to go through and battle some of these past hurts and pains, and then celebrate that forward moving or that progress that we're able to make. Because a lot of times we don't do that, and that actually helps to keep us stuck, honestly. So Celebrate Recovery, really, when you get right down to it, it's a biblical-based program. It's been around for over 30 years. It's started at Saddleback Church, honestly. And I think back at the time, they had about 42 members when they started this thing. And now I think it's up to a little over 35,000 churches have Celebrate Recovery in them across the world. That's pretty amazing. And they've helped over 8 million people. So one of the things we're doing with Celebrate Recovery, if you want to get down to the nuts and the bolts of it, is it's all about developing that relationship with Christ. And through that relationship with Christ, you're able to better deal with the hurts and the hang-ups and the pains and the problems of life. There's no question about that. One of the side notes I think is very fascinating about that is as you're developing that relationship with Christ, it is helping you to learn how to better develop the relationships in your own life and to be able to navigate those much better. One of the things we see, I see it in my life and my wife's life as well, and other people in Celebrate Recovery, is that your relationships do in fact improve. And I married my wife, and I'm in love with her, and I always have been, and she's like fantastic. And I said, how could this ever get better when we first started Celebrate Recovery? I would have to tell you now it's probably 100 times better, just simply by learning how to have a better relationship with Christ. Those kinds of things happen. It's just amazing. I can't talk enough about how important that is. Thank you.
As Barry said, my name is Stephanie Wick. I don't want to spend a lot of time on myself, but I've been a mental health provider and marriage and family therapist in this area for a long time. I've known Mick going back to 2011. We worked at Fort Riley together and have been blessed to get to know Barry even more here over the last year or so. So I'm excited to be here and talk about this. Obviously, this is something I do every day. Mick and I and Heather, I've got another colleague here who's helping us with this tonight. We spend day in and day out in this world of mental health. And so this is something that we're very familiar with. It's something, obviously, we all acknowledge that this is a conversation that needs to be happening even more than it is. So when Barry presented this idea of this seminar, of course, I was excited at any opportunity that allows us to move this conversation forward, right? Mental health has long been stigmatized. It carries this taboo with it. Often it's believed to be the result of some sort of personal or religious failing, and that's not the case. And so my hope is that by the end of tonight, you have a better understanding of what mental health is. I'll be presenting an outline here in just a moment. But let's start with this. Good people, capable people present to therapy all the time. In fact, I would go so far as to say these are some of the bravest people among us, the people who are willing to face those difficult issues, the hurts from the past, to be completely vulnerable with someone else. I'll tell you, therapy is one of the most intimate relationships you'll have because you're bearing your soul essentially to someone. There's a misconception, this is part of that stigma, there's a misconception about people who go to therapy, and you can probably even be thinking in your own minds what you think that is. These are people they're a hot mess, they're just plain nuts, they're crazy, there's something wrong with them, right? That's not the case. We see, good people every day. Doctors, stay-at-home moms, teachers, business people, people who are out of a job, farmers, and the list goes on and on and on and on. These are good people, these are capable people, these are people who are raising families, who are holding down jobs, but who have encountered something in their lives that they are struggling with, or they've been carrying these burdens for most of their life, and they're finally at a point where they're ready to have that conversation. The other thing that I have learned doing this for so long is that there are no new problems under the sun. None, I promise you. If you think that whatever you are dealing with if you think you are the only person who is dealing with whatever you are dealing with, I promise you you're wrong. You guys are special. I know you're special, but you're not that special, right? There are no new problems. I think anyone who has worked in this field long enough can attest to this. Eventually, you just begin to see different presentations of the same problems over and over. So I guarantee you, with the number of people that we have in the audience or watching online, we've got a variety of problems, and none of them are new. Okay? I hope that in knowing that gives you some peace of mind, knowing you're not the only one who has struggled with whatever it is that you're struggling with. You're not the only parent who has had a child struggling with whatever that child is struggling with. These things have been around for decades, for hundreds of years, right? There are no new problems. And I will say, we have limited time tonight, and because I talk about mental health all the time, I am going to use my notes so I can stay on track. Otherwise, I'm going to be inclined to go 1,000 different directions. So I'm going to use my notes tonight. In some of the promo videos for this seminar, you've heard them say that mental health exists on a continuum. All of us exist on a continuum of mental health and unhealth. In the same way that everyone in this room, everyone watching online exists on a continuum of physical and spiritual health and unhealth, right? So if we look at this continuum, and this is 100% healthy, and this is 100% unhealthy, you guys are all somewhere right in here. Every one of us is somewhere right in here. Not acknowledging or identifying the fact that there may be some mental health issues does not change the fact that those things exist. It just means we're not talking about it. It just means that we're not having the conversation. They're still there. We're just not acknowledging it. That's part of why tonight is so important, is because we're having that conversation, right? We're talking about it. I think everyone in here anyway, would claim to have a mind, right? A brain. Everybody here has a brain, right? Yes, okay. Everybody's got a brain. And because everybody here has a brain, that means everybody here has the capacity to feel emotion. And because you have a brain, and because you can feel emotion, that means you have mental health and you have emotional health. Every single person in here, unless you don't have a brain, and then we've got another conversation, but everybody here does. So the conversations, the information that is being shared tonight applies to every one of you. Every single one of you. If you are diagnosed with diabetes, what do? You go to your doctor, right? You take medication. You change your diet. You make changes in your lifestyle so that you can stay well. Why do we do the same? Why do we do it differently with mental health? Why do we assume that our mental health is any less important than our physical health? If you have diabetes or celiac disease or any number of other disease, you're not going to ignore it. What happens if you ignore it? You're going to get really sick. You might die. Okay? You don't ignore the physical. We should not ignore the mental or the emotional. So I'm in good company because I also have a brain and I am also human, which means I am not exempt from the information that I'm sharing with you tonight. I have a sister who was diagnosed type 1 diabetic when she was 28. She has to take her insulin. She has to make sure her pump is working. She has to eat the right kinds of foods and stay active. She has to meet with her doctor, right? She has to do all of these things to stay well. Like her, but unlike her, I don't have diabetes, but I do have something called Generalized Anxiety disorder, which is a conversation that we'll dive further into next week. And so what that means for me, I take medication. I have to eat the right kinds of foods. I have to move my body and exercise. I have to talk with my doctor about it. I have to do all of the same kinds of things that she does to manage her diabetes if I want to stay well. I want you to look around you briefly. Just look around. I'm not opposed to making you squirm just a little bit. You are surrounded by people who are somewhere between 100% healthy and 100% unhealthy. And quite frankly, I don't know that those two exist, right? Which means we're all right here. The person to your right, the person to your left, behind you, me. We're all on this continuum. None of us is ever 100% healthy or 100% unhealthy. And I don't know if you know this, but even Mother Teresa lived with major depression for the duration of her life. Serious depression and hopelessness and despair. Even Mother Teresa is not exempt from this. What that means is that at any point through our lives, we're going to be sliding right or left on that continuum based on a number of different things that we'll be talking about. Most of us aren't stationary in our mental health. So you're not born mentally healthy and then you stay mentally healthy. Just like as we get older, our bodies will start to fail. We got to go to the doctor more, right? We have to work a little harder to keep ourselves healthy. It's the same with mental health. We'll slide right and left. Maintaining our mental health is a long game. This isn't a one and done. It's no different than maintaining our bodies and our physical health. Most of us understand that we can't go to the gym and do a push-up or a pull-up and we're good, right? We are physically healthy. We're good. We've marked that box. And it's the same with mental health, right? If you want to keep your bodies healthy for the duration of your life, You're going to be fairly mindful of eating mostly well. I'm a big advocate of like the 75-25 diet. Eat 75 well and 25 whatever you want. You're going to move your body. You're going to make sure you're going to the doctor for physicals. You're going to take the medication if you need the medication. It's a series of things that we do consistently and over the duration of our lives that keep us as mentally healthy as we can be. There's a quote that I love, and I wish I knew who said it because I would love to give the person credit. It's a quote on self-care, so we're in this crazy kind of self-care culture. But this is a really good one. The quote is, "Self-care is creating a life from which you don't feel the need to escape." Creating a life from which you don't feel the need to escape. So it can be the manicures, it can be the chocolate, but what it is more than that are doing things consistently and over a period of time that allow you to be as well as you possibly can for as long as you possibly can. The nature of the human condition is to experience a range of emotion. This is what we're created this way. We're created to feel good things. We're created to feel not so good things. The only thing worse than feeling all these, what can feel like crazy emotions, is to not feel anything at all. And if you don't believe me, ask someone who has struggled with depression and is completely apathetic and can't enjoy pleasure at all. They will tell you, I would much rather feel all these things than feel nothing at all. It's a gift to feel these things. Emotions, and this is important, so if you're taking notes, remember this. Emotions in and of themselves are not an indication of mental illness or mental unhealth. You may feel a range of emotions. Feeling those emotions, even if you're feeling lots of them, is not an indication of mental unhealth. There are no emotions that are inherently bad. None. We're created to feel these things. An emotion is an emotion is an emotion. A feeling is a feeling is a feeling. Some feel better than others, right? Like we would all love to feel euphoric and happy all the time. But really, it's just a feeling. It doesn't have any more or less weight than if we're sad or we're angry. Anger, for example, this is one that often gets pigeonholed into being a bad emotion. Anger can be it is a natural response, right? To feeling wronged, to feeling hurt, to feeling maybe rejected. It can be a red flag for us that something's wrong if we learn to pay attention to it. Anger by itself is not a problem. Anger is no more problematic than being happy all the time. However, if that anger occurs perpetually and habitually and becomes destructive, then it becomes a problem. Sadness is another more unpleasant emotion. Sadness in and of itself is not a bad thing. It's something we all feel, and if you have never felt sadness, please, you can come replace me up here because you're doing something. I don't know what it is. Sadness is not a bad emotion. However, if you're feeling sad more days than not, then it might be an indication of a problem. Each of you is here because you have an interest in learning more about this topic. You have someone that you love that you are concerned about. Maybe you're concerned about yourselves. My goal today is to give you enough information without overwhelming you. Some of what I will share may seem very simple and rudimentary, but I feel like it's important to answer these very basic questions before we move in to some of the more complex or complicated things. And so tonight is more of an overview of these things. I do hope to challenge the way that you think about mental health. I hope that when you leave here today, you have a little bit different feeling or belief or understanding about mental health. And when you hear those words, you don't cringe, right? How many of you, in all honesty, when you hear the words mental health, like start to twitch a little bit. I mean, there are people like mental health, mental illness, like they get all twitchy with it. It feels uncomfortable. Okay, here's our overview for tonight. We're going to cover what is mental health, what is mental illness, what affects it. We're going to talk about the stigma that surrounds it, and I'm going to challenge each of you there. We'll cover the prevalence of mental illness, how to help yourself, and what to do when helping yourself is not enough. Because let's be honest, you might be doing all the things right, and you may still be struggling. And that's a very real thing. Sometimes you can't run it away, you can't pray it away, you can't sleep it away. It's just there. And we'll talk about some of those things. And then, of course, the last 30 minutes are going to be Q&A. So I would encourage you, as we're going through the material, if there are questions that are coming up, please text those to the number that was provided so that we can be answering those, okay? Okay, what is counseling and therapy? I don't know if it's there we go. Okay, these two terms, again, this is basic, but these two terms are often used interchangeably. So you may hear someone say, I'm going to counseling or I'm going to therapy, and really, it's not a big deal. Most of us are content, most of us providers are content if you call us counselors or therapists. But there are some slight differences, and I'll share this just so that you're aware. Counseling typically is working with a mental health counselor, clinical mental health counselor, on a specific issue for a limited amount of time. Therapy, if we're going with the truest word, or the truest form of that word, is something that's a little bit more in-depth. It's going to be diving more into behaviors and emotions, maybe complex trauma, things that have happened in the past. My initial clinical specialization was in the area of death, dying, grief, and loss. And the way that it was explained to me as I was studying this, was that grief counseling would be helping someone who is progressing normally through the stages of grief. Okay? It's an expected response to a loss. They're progressing normally. It's grief counseling. Grief therapy would be they have encountered complications in the grieving process. They have become depressed, or they're suicidal, or they're stuck in the process somewhere. And so it has elevated to a bigger issue. So that's just one way to kind of understand the differences in counseling and therapy. If you hear those words, they're essentially the same thing. Most people don't care or really need to know the differences, but that just helps you understand that. The other thing I wanted to touch on is what are the different types of mental health providers? I've been called a psychologist more times than I can count. I'm not a psychologist. I mean, I wish I were, but I'm not. Okay, so we're going to start with psychiatrists. Okay, we're just going to break this down. A psychiatrist is it's a medical doctor who basically has special training in psychiatric disorders. Okay, so if these are MDs who have training in psychiatric disorders, and they can diagnose, they can prescribe and monitor medication, they can do med checks, they can do therapy. Okay? These are the people who write the prescriptions for the medications that we'll be talking about later. And if anybody's considering a career change, we need more psychiatrists. So it's never too late. There's a shortage of psychiatrists. Next, we have psychologists. Psychologists are going to be doctoral level individuals who have gotten a degree in psychology, clinical psychology. The difference with psychologists is that they are trained to assess, evaluate individuals. So they can do psychological testing. They might test for ADHD or some of those other things that some of these other providers don't necessarily do. Okay? So if you need a psychological test, you're going to probably go to a psychologist. If you need medication, you're going to go to a psychiatrist. These other three, social worker, marriage and family therapist, licensed professional counselor, we all do very similar things. I am a marriage and family therapist. Mick is a marriage and family therapist. The difference being with Social workers, we can all assess, diagnose, and treat. Okay, social workers have a little bit more training in case management and some advocacy kinds of things. Marriage and family therapists, we are trained systemically, which means we're trained to work with mental health disorders within the context of couples and family systems. And licensed professional counselors, they can treat all of it, okay? So if you're looking or considering a mental health provider, you're probably going to be looking for one of these lower three. Psychologist, if there's some sort of testing that needs to be done, psychiatrist for medication. So that's all boring stuff, but I think it's important to differentiate because I know there's a lot of questions about the different kinds of providers, and I just hear this as people are talking often. All right, so what is mental health? Seems like a basic question. Mental health is generally how you think, the overall wellness of how you think, feel, and behave. Okay, so you imagine this triangle, and you've got your emotions or your feelings, you've got your thoughts, your cognitions, and then you've got behavior. And so mental health is the three of these things, and the overall wellness. It includes emotional, psychological, social well-being. Occasionally, there are disruptions in one of these three areas, or potentially in all of these three areas, which is where we start seeing mental illness, okay? If you're struggling with a mental illness, and we have a very large manual that we use to diagnose these things, right? There's a process to diagnosing it. I know there's a lot of, it's interesting because, on one hand, we've still got all this stigma, this taboo around mental health. And then on the flip side, we're noticing that it's almost become trendy in some circles to have a mental illness or to have a therapist. And it is a really interesting dichotomy that we're seeing. And this tends to be a younger crowd over here. It's interesting. We'll talk more about self-diagnosing and avoiding some of this down the road. Okay, mental illness. Let me go back to my notes here. Mental illness may affect, if we can move on here, how well you can maintain personal or family relationships. This could be at work. This could be at home. This could be with friends. How you function in social settings. So are you belligerent? Do you have a difficult time even getting into social settings? So for example, when we were planning this seminar, it was important for us to make it available online, right? I'm very aware that there are individuals who want this information who may feel very uncomfortable coming into a place like this because they're too depressed to get out of the house, they're anxious coming in and being around a bunch of people. Right, so mental illness can affect how you function in social settings, how you perform at work or school, how you learn at a level expected for your age, and how you participate in other activities. So basically, it can affect how you live your life. It can interfere with living your life. And you're going to see disruptions in all these different areas, okay? The other thing, and this is interesting, as we talk about what is mental illness, who decides what is mentally ill and what is not mentally ill, who are the powers that be that sit down and decide this is what it is? Well, cultural norms will actually influence what we consider to be mentally healthy and mentally unhealthy. So if an individual is so a social norm obviously is these are the rules or the prescriptions that any person is expected to live by in any given culture or subgroup or context, right? And so if someone is living consistently in deviance of that, so it's persistent, it's recurring, it's habitual, it's happening all the time, then that's one of the larger overarching concepts, I guess, that is used to determine if something is mentally healthy or mentally unhealthy. So for example, and I'm going to read some of these, just so you have an idea of how common the social norms are, because we all live by these social norms every day. So for example, It is not considered acceptable or mainstream to abuse drugs, particularly heroin or cocaine, right? And so if I was up here and I was doing a line, there might be a problem with that, okay? It's not considered acceptable to drive at 90 miles per hour in a residential area. We would call that risk-taking behavior, careless behavior. Some of you might disagree with this one, but typically it is not considered a normal behavior to be talking to yourself in public, right? Now, some of us do. Our thoughts come out as words, but if it's happening consistently, that could be a problem. Stealing, not considered socially appropriate. Nudity in public is not acceptable in most areas, right? We're all dressed. We all have clothes on. If you're at home, I don't know. Maybe you don't, but that's okay because you're at home. If you're here, you have clothes on because that is the social norm, right? We wear clothes when we go out in public. If somebody is streaking all over the place, all right, that's not normal behavior, right? If you got a streaker at the Super Bowl, maybe he's just having fun, right? Trying to get his 5 seconds of fame. But if he's streaking through the Super Bowl game and through the church parking lot and down Main Street, then it's a problem, okay? We're expected to be honest. If you're habitually dishonest, that's a problem, right? At least here, being married to more than one person is not considered acceptable. That's a social norm. Staying loyal to your spouse is considered to be the social norm. Not abusing children, right? We don't abuse our children. That's not considered socially appropriate. If Barry showed up to church in a Speedo, that would not be appropriate. That is a social norm. The pastor also wears appropriate clothing when he's talking. Ignoring someone. If I were talking to one of you and you're just like completely ignoring me, that could be a problem, right? The norm is that we're going to pay attention. If you're not, it could be an indication of some other condition or illness, right? So I share all of that just so that you have an idea of like when we're deciding, when the powers that be sit down and they write this large manual that says this is considered a mental health diagnosis, these are some of the things that they're taking into consideration. Okay, the stigma of mental health. Trying to decide if I want audience participation or not. Don't make eye contact. This is such a real thing. And in fact, as we were planning this, it was very intentional even to have it in the auditorium versus the garage, right? That was very intentional, right? Because even though we work in the field of mental health, we're still very aware that people feel kind of twitchy around the area of mental health. And it happens on a daily basis. And I asked earlier, how many of you get a little weird if you start hearing things like mental illness or depression or anxiety or bipolar or some of these things that we hear regularly? There's a really uncomfortable feeling that comes with it. Part of this is perpetuated by a lack of information, lack of education, general ignorance about what mental health and mental illness is. In fact, this is probably one of the biggest factors. So people don't understand it, so they cling to the stereotypes about it. And how often do we see this? Whether it's a different social group, it's a different ethnic group, they're from a different country, they have different beliefs, right? We don't understand it, and so we hold it at arm's length. The media, think about movies, right? Like, how are people like me portrayed in a movie? Really, right? There's probably a couch, and there's a notepad, and it's very clinical and dreary. Mental health or mental illness in the media is often portrayed as what? They're crazy, they're dangerous, they're out of control, they can't function. Think about it. I want you to think. This is where I'm going to challenge you. Think about how you think about mental illness. Do you believe that what you see on TV is an accurate portrayal of what mental illness is. It's not, largely, but do you believe that? Have you bought into that? I've done this for 17 years, and at one point I counted up the therapy hours that I've done, and it was somewhere around 20,000. And in those therapy hours, I don't know if I even need one hand to count the number of violent people I've encountered who have mental health problems. I don't need one hand to count the number of people I've met with who are crazy, okay? So ignorance, the lack of education, the media, and then finally the language. If someone is brave enough, and I've used some of these words, but when you think of mental illness, what are the words that come to mind? Is anyone brave enough? Where are my extroverts, Barry? Bipolar. Insane. Crazy. Yeah. Psychotic. Insane. Lazy. Nuts. Right? Like, these are the words that we use to talk about mental health, which is so ironic and funny, not funny, because we all have mental health. Right? How many of you have had moments where you feel like, I am losing it? Like, I just might be crazy. I don't know. We use the language ourselves, right? So, the language that we use, rarely do we have language attached to mental health or mental illness that is positive. It's always negative in connotation. I mean, I've never heard someone say, I am bipolar, it's just the best thing ever. These people are fantastic. It's always negative, always. Always, always, always. So there are, and this may not be a fully inclusive list, but there are at least 8 types of stigma. And as we go through this, again, I'm going to ask that you reflect quietly on the degree to which you also hold these beliefs. And I think what you'll find as we go through them, that you do, at least some of them, you're gonna be able to say, ooh, yep, that applies to me. As I was going through this, I was embarrassed to say that, ooh, yep, that applies to me. So even when you work in the field, you can still buy into these stigmas. So the first is the public stigma. Okay, this is what happens when the public endorses the negative stereotypes, these negative beliefs, these prejudices around mental health, mental illness. Self-stigma is when we take those public stereotypes and we internalize them. So you make them yours, basically. So if the public stigma is people with mental illness are crazy, then the self-stigma would be, I'm crazy. I have anxiety, I have depression, I have PTSD, I have bipolar, I have social anxiety. I'm crazy. So you take these public stigmas and you make them yours. You apply them to yourself. Perceived stigma is how will others perceive me, or how do I perceive others? The belief that others have negative connotations about people with mental illness. This next one, label avoidance, is, this one is a problem. Okay, so label avoidance, basically, this stigma is, I'm not going to go to therapy because I don't want to be part of that crowd. I don't want to go to therapy or ask for help because that label will apply to me. It keeps a lot of people from reaching out for the help that they need. Right? They might be able to say, yes, you can go. I fully support you going to therapy. I'm not going to go because I'm not one of them. I don't want that to be attached to me. So think about that. If there's anyone in here, have you had that thought, gosh, maybe I need to get some help? And then you think, nope, I'm not doing that. Keeps a lot of people from getting the help that they need. And then we get into some of these larger ones. The stigma by association. How many of you have avoided befriending someone because they had a mental illness? Like, I don't want to get too close to that person. That might be a reflection on me. Years ago, I was introduced to the term EGRs, extra grace required, right? So these are the people that struggle more than maybe the average people or have needs that supersede the average person, the EGRs. So it could be, no, they're going to require too much of me. What will people think of me if I'm with him or her? That's stigma by association. Have you ever avoided talking to someone, going out to coffee with someone, approaching someone at church, at work, or someone else because you were afraid of how it would reflect on you? I have done this. I'm ashamed to say I have done this. The structural stigma, this is organizationally, institutionally, the policies, the things that are in place that discriminate against people against mental illness. Health practitioner stigma. So if there are any health providers in here, listen up, because this happens often. So doctors, nurses, you fill in the blank. If you're working in the world of health, the health practitioner stigma is any time a professional allows stereotypes and prejudices to negatively affect a patient's care. It might affect the recommendations they make. They may not encourage therapy. It might affect their beliefs on medication and whether this person needs medication. If you work in the area of healthcare, please, please, please pay attention to this. Because you could be neglecting a really important area for the patients that you're working with. If you have this stigma, you need to get it in check, in my opinion. And then, of course, cultural stigma. And this could be a big topic in and of itself. And this can be country to country. This could be ethnic group to ethnic group. Based on the culture, there are going to be different stigmas attached. I'm not going to go into a lot of that because that could be a whole presentation in and of itself. So as we go through these, I'm telling you, I want you to reflect on these. Show of hands if you're comfortable. How many can at least say at least one of these applies to me? Okay, that's pretty well everyone in this room. Just to give you an idea of the prevalence of mental health, mental illness in this country, and I will say that America, we rank at the top for the prevalence of particularly anxiety and depression. We are one of the most, if not the most, depressed country in the world, and we are one of the most, if not the most, anxious country in the world. We'll dive deeper into all of that next week, but just to give you an idea. Anxiety disorders, most common mental illness. And ladies, I'm sorry, but most of these are more prevalent in women. That can be a whole nother conversation. Anxiety disorders are the most common mental illness in America. Roughly 40 million Americans have some type of anxiety disorder. When I say anxiety disorder, keep in mind that this is diagnosable anxiety. Okay, again, we'll dive deep next week. This is not, I feel anxious. These are diagnosable disorders. 40 million Americans have some type of anxiety disorder. Generalized anxiety disorder, which is the version of anxiety disorder that I have, almost 7 million adults. Panic disorder, 6 million adults. Social anxiety, 15 million adults. Obsessive compulsive disorder, 2.2 million adults. PTSD, 7.7 million adults. The leading cause of disability in the United States, for people ages 15 to 44, 45 is major depression. factors of, okay, I go over the prevalence so that you know how common this is, right? Like it's everywhere. If the leading cause of depression is the leading cause of disability is major depressive disorder, don't you think we should be paying attention? There are more people out of the workforce because of depression. This is a little bit further down in the presentation. Does anybody want to take a guess at dollar amount, lost earnings per year because of mostly depression, but mental illness? Anybody want to guess? I'll make it easy. $210 billion in lost earnings because of mental illness. All right, so when we talk about mental illness, if you remember when we started this, I said that there's this belief or this misconception that mental illness is the result of personal or religious failing, right? So the belief that if you just prayed harder, if you just had more faith, if you just exercised more, if you just had better friends, then you wouldn't have any mental illness. And do you know how damaging that message is? And maybe some of you have been on the receiving end of that. Or somebody has said, well, why don't you, if you just did this, if you just got out more, right? That's what we do when we're talking to someone who's struggling. We give advice. Why don't you just do this? Go run, go get coffee. Give it to God, right? And the message in that is if you were just doing more, you would not be struggling. If you just did your job better as a human, you would not be struggling. There are a lot of people who have been hurt deeply by that message, both in the church and outside the church. So when we talk about factors that affect mental health, the one is biology, right? Our genetics, our brain chemistry. Some of us are just born a little left of center, okay? I was born a little left of center. Like, if we get into it, my amygdala is on overdrive all the time. I can't do anything about it. I can't pray that away. I can't run that away. It's just a little broken. So if you know your family history, and you can think through that briefly here, mom, dad, grandmas, grandpas, can you identify within your family trees depression or anxiety? We'll just stick with those two. Right? It may not have been called this. Probably wasn't called this. Maybe it was, oh, she's just a nervous Nellie, or he's just a sad sap, or whatever kind of euphemisms we would use to describe it. Many mental illnesses have a genetic component, right? You're born that way. You lost the genetic lottery. You were born that way. Experiences. And we start accumulating experiences from the time that we're born. Some of us are born into families that are healthy and loving, and all of our needs are met. And we have secure attachments, and we trust the world and the people around us, and we're not abused, and we're not neglected. Okay? We're probably going to fare a little better than the person born into a chaotic family or the broken family that's laden with abuse and neglect and violence or drugs or alcohol. Right? So our experiences from the time we were born throughout the remainder, the duration of our lives is going to affect our mental health. So, for example, job loss. You might lose your job, and you may experience, because of that experience, some depression, some anxiety, some hopelessness. The death of a loved one, right? It's an experience. You might be pretty healthy prior to that experience. You might dip into a period of depression after that. Not always. Divorce. break up with a boyfriend or a girlfriend, right? Like, life is full of experiences, and some are great and some are not, and the ones that are not likely can affect your mental health. And then circumstances, environment. So are you working in a toxic workplace? Are you living in a family that's not well? Our circumstances can also affect our mental health. So mental health is much broader than you just suck, right? Mental health is you were born that way, maybe. Mental health is brain chemistry. You've got a special kind of brain. Congratulations. Mental health is you've had experiences, trauma, something that has affected you and your mental health. And circumstances or your environment. These things all feed into our mental health, okay? So what I'm saying is it's not your fault. I've never met a single person who has chosen to be anxious or depressed, who has chosen to be traumatized, who has chosen to live with bipolar disorder. I have never met someone who has chosen that. So if you have been on the receiving end of that message, I'm sorry. Please hear me. It's not your fault. And if you have delivered that message, maybe well-intended, to someone else, think twice before you do that again, right? It's not their fault. People don't choose to be mentally unwell. And if they do choose to be mentally unwell, then that's an indication of some other mental illness, right? Okay, briefly, systemic and health implications. I don't want to spend a lot of time here. As a marriage and family therapist, we're trained systemically, which means if you imagine a family system as a mobile, those things that hang above a baby's crib, right? And let's say you knock one of those little, whatever those are, then the whole mobile is gonna be affected, right? The whole mobile is gonna be moving. That's the same with mental health. If you've got someone in a family who's got mental illness, it's gonna affect the entire family system. It could be a child, it could be a parent, it could be a spouse. If you've got someone who is struggling, it will in one way or another affect the whole family. Health implications, we'll cover some more of this next week. Just know the body and the mind are connected. So, heart, blood pressure, sleep disorders, substance use disorders, respiratory illness, thyroid problems, all of these things can be attached to mental illness, okay? So if we're mentally unwell, often we will have some physical problems as well. The difference between acute and chronic. Again, very briefly. Some people live with this their entire lives. Some people are depressed their entire lives. I am anxious my entire life, okay? So if you imagine how you might feel getting up here and presenting, and then assume you feel that way all the time, that's what it's like living with generalized anxiety, okay? So it's something I live with. Versus acute, which could be there's a situation, there's a circumstance, there's a response to that. It's relatively short-lived, okay? Some of us live with it our whole lives. Some of us have an experience, and then we dip down, we recover, and we move on, okay? There is a difference. Okay, moving into sort of the meat of this, how to help yourself. When I work with patients, when I work with clients, of course, a vast majority of the people we work with are going to fall under this umbrella of depression or anxiety, some version of that. I always assess for 6 things, always. These are things that every one of us can and should be doing to keep ourselves well. They're very basic. These are not hard. Nutrition. Are you eating mostly well? Excuse me, I say mostly well because you also want to enjoy certain things, right? That's why I said 75, 25, 60, 40, I don't know. More than 50% well. Check that, because I'm telling you, if you're not feeding your body what it needs, your mental health is going to suffer. If you're eating crap all the time and drinking soda and eating processed food, like it or not, even if it feels good in the moment, it is not giving your body what it needs to have the best mental health that it can have. The mind and the body are connected. In fact, some of you may have heard about the gut brain, and this is not my specialty, but the gut brain, if you've ever done any reading on that, it's this idea that 95% of our body's neurotransmitters are produced in our gut, not our brain. Right? And there's this nerve, the vagus nerve, the superhighway that runs. If you're not taking care of your body, it's not going to send your brain the signals it needs to do well. So, nutrition. Oh, and by the way, this all requires work on your part. Like, this is not always easy, but nobody can do this for you, right? Like, this is 100% on you guys, sorry. Exercise. Move your body. As we get older, sometimes it is just moving your body, right? Like, you're just moving your body. Walk for 5 minutes. Just move your body. Maybe you're not CrossFitting or powerlifting or whatever. Move your body. There's a lot of endorphins and things that come from moving your body that actually soothe anxiety in particular better than medication will. Move your bodies. Social relationships and health. How are your social relationships? Are you isolating? Do you have toxic relationships? These things are important. If you don't have relationships, you need to find relationships, which I understand can be hard, and we'll talk about that. Spiritual health. How is your spiritual health? Are you unhealthy? Are you disconnected? Are you feeling pretty good? There's tremendous research, whether you're a believer or not a believer, there's tremendous research on the mental health benefits of faith. So, like it or not, there's a connection there. And so, check your spiritual health. Sleep quality. How many of you sleep well? Oh, freaks. How about this? How many of you don't sleep well? There we go. That's more like it. You're my people. Okay. How is your sleep? If you're tired, everything's bad, right? Like you can't function if you're tired. If you're tired, everything will be worse. Your ability to choose the right foods will be worse. To tolerate stress will be worse. To regulate emotion will be worse. In fact, if I were saying of all of these, if there's a place to start, if your sleep is bad, get it in order because it's going to affect all the rest. And then time outdoors. Again, I'm not making this up. This is research. Get outside. Okay? So when I'm meeting with people, I say these 6 things. We check in. How are you doing on these 6 things? If there is room for improvement, then that's where we start. Most of us have room for improvement. Okay? I've yet to meet anyone who's really doing all 6 of these as well as they could be doing. And again, nobody can do this for you. So then the question is, what happens if you are doing all of these things and you're doing them to the best of your ability and you still feel like crap, right? You're still anxious, you're still depressed. What then? Because that happens. There are a lot of good people who are doing their best to do all of these things and they still don't feel well. It's not working, it's not enough. This is when you might know that you need therapy. And please, as we're going through this, think about it, okay? If you're noticing changes in your personality, eating, or sleeping, and again, as a mental health professional, these are things that we assess for routinely. Marked changes in personality, eating, or sleeping. So as I go through these, think about the last 2 weeks or month or maybe even 6 months. An inability to cope with problems or daily activities. So maybe things that you used to be able to handle fine, you're struggling with now. Feelings of disconnection or withdrawal from normal activities. Maybe you used to go to the gym 5 days a week and now you can't go any. You just can't find the motivation to go. Maybe you used to meet up with friends for coffee once a week and you've slowly but surely withdrawn from that. Unusual or magical thinking. I do this all the time. Like, what if? It's like daydreaming. It's like It's not necessarily based in reality. Again, if you're doing this occasionally, not a problem. If you're doing this often, escaping from reality, it's a problem. Excessive anxiety. Sadness that's lasting more than a couple weeks. Right, so if you're sad, that's fine. If you're sad 7 days in a row, 14 days in a row, that could be an indication that you need to get some help. Obviously, any thoughts or statements about suicide, harming yourself, harming others. If you're abusing alcohol or drugs, of course, any illicit drug is a red flag. If you're drinking more, let's say you used to have a drink once a week, twice a week, and now you're drinking every night. COVID, I don't know if you guys have seen the numbers with COVID, but alcohol consumption with COVID has skyrocketed. Really high. Liquor stores did really well during COVID. So if you're drinking more, if you're using drugs, that's an indication of a problem. Extreme mood swings. All of us are going to sway, right? Extreme means you're going from polar to polar. These are big mood swings, and they feel like they're outside your control. And if you're really angry, really hostile, violent behavior, these are all indications that you might need to seek therapy. I mentioned earlier, please avoid the temptation to self-diagnose. There's a trend right now of mostly young people who are self-diagnosing. Try not to do that. I said there are criteria that must be met for you to meet a mental health diagnosis. Often, word diagnoses get thrown around very flippantly, right? And maybe we've done, I'm so depressed. Oh, I just have OCD. She's bipolar. How many of you have heard somebody refer to somebody who has mood fluctuations as bipolar? Okay, there are very strict criteria that individuals must meet to meet these diagnoses. So just avoid the self-diagnosis, avoid using these labels flippantly, because the people who struggle with them, it's like saying, it's not that big a deal. It is a big deal. One of the questions that we get presented with often is medication. And I'm the first to say I'm not a pill pusher. I am on medication. It took me many years of fighting my own anxiety to move past all those stigmas that we talked about, to finally say I needed some medication. So I am on medication. Lexapro is something I take every morning to help keep me in a good place, right? It's not for everyone. Something to keep in mind, medication is only a conversation I have with someone after we have assessed for those 6 things. First, I want to know, are you doing your part? Right? And that may look different from person to person. Are you doing what you need to do to be healthy? Are you doing all that you're capable of, right? And if the answer is yes, then we have this conversation. Medication is only one part of treatment. I would strongly discourage someone from only being on medication and not participating in some therapy, at least in the beginning. Medication should be used in conjunction with those 6 things. So if you take a pill and you think it's going to fix everything, you're going to be sorely disappointed, because it's not. You need to do your part. You guys remember who prescribes the medications? Psychiatrists. Your medical doctors, your primary care docs can also prescribe medication. All right, so the psychiatrist is the MD with a specialty in psychiatric disorders who can prescribe medications. If you are already established with a primary care doctor, a family doctor, he or she can also prescribe. And most are comfortable prescribing up to a point, and if they start to feel uncomfortable, they'll encourage you to meet with a psychiatrist. In some cases, the medication is necessary first so that the person can do what they need to do to get well, okay? So there are situations, especially with people who are living with major depression, who They might see those 6 things and say, yep, I know I need to be doing them, but I can't. If you know anyone who's lived with depression, they know what they need to be doing. Telling them what they should be doing is not helpful. They know what they need to be doing. They just cannot do it. Am I doing that? Okay.
Just the wind noise from
Okay. Okay. In those situations, sometimes the medication can give someone just enough to where they can move their bodies. They can make better food choices. Medication is somewhat unpredictable. They don't know exactly who's going to respond and how. But if you've done your part, then please meet with a doctor, psychiatrist who can help walk you through that process. That's not going to be someone like me, but someone who is trained in that and who has the ability to prescribe and understands medications can do that for you. Sometimes it's short term, sometimes it's long term. I don't know how long I'm going to be on medication. It's working right now, so I'm not going to mess with it. Some people will be on medication briefly just to help get them through a difficult period in their lives, and some will be on long term. Okay? It can go either way. And sometimes it's just a matter of trying one to see how you respond to it. Okay. Let's talk about therapy and expectations of therapy. Interesting, through COVID, mental health providers, like teachers and a lot of other people, worked really, really hard. And there were a number of us who struggled in our own way, just through the most intense parts of the pandemic. And so I thought, I'm going to get a therapist. And so, because I worked with so many people in this area, I thought I'll find someone in Kansas City and I'll do telehealth. Well, I reached out, left her this really nice email, and I never heard anything back. That's how busy mental health people are. These are some things to keep in mind. The length of therapy is going to vary based on what the presenting problem is, how long you've been dealing with it, how ready you are to change. Okay, some people are in 3 months, some people are in therapy for years. I have a number of people that I've worked with for years, and that's okay. Some people use it like they would use physicals at their doctor or checking in with their primary care doc. It's part of their regimen to staying well. Therapy is not a magic pill. And there's nothing more frustrating than the person who comes in and they think that we have a magic wand and we can fix it, and that's not the case. We can do our part, but no therapist can work harder than the patient. And so it's not a magic pill. It does take time. You're not going to show up to the therapist office 1 week and walk out and be fixed. Right? A lot of times people are coming into therapy because of issues that have been long-standing. So it takes time. Every therapist is different, so you could meet with me, or you could meet with Mick, or you could meet with Heather, and your experience with each of us is going to be very different. The most important part of therapy is going to be the relationship that you have with your therapist. If it is not a good fit, it's not going to work well. I told you therapy is probably the most intimate relationship a person can have, right, in sorts. It's intimate, and so you need to feel very comfortable with that person. So the therapist-client fit is important. You should know that therapy can be exhausting. If you've ever gone and you have a heavy session and you walk out and you're like, whew, I feel like I need to take a nap. We hear that often. It is emotionally draining, and things that are emotionally draining are physically draining. So it's common to feel very tired after therapy. It's also common to subconsciously avoid having the conversations that you should be having in therapy because you know they're going to be difficult, right? Or to show up late to therapy, or to, we call them doorknob disclosures, where somebody's on their way out of the room, they're like, oh, by the way, right? That's common because those things are hard to talk about. I'm going to read a little something that I wrote some time ago, and I'm just going to read it because it's written, quite frankly, and it's something I wrote about meeting with a therapist, but I think it helps to capture some of this. It's called Hello Pain, Meet Your Therapist. Most people have no idea what to expect when they walk into a therapist's office for the first time. Anxiety is often high. Expectations are often based on depictions from movies or TV shows. This means newcomers may expect a stiff-lipped, notepad-bearing therapist with no sense of humor who asks the client to lay down on the couch for an awkward first session. I've never done that, by the way. There's something mystical about the world of psychotherapy, as if we can see into the souls of every person we meet. While this is not the case, most of us have developed a keen sense of human behavior and are more aware of the subtle nuances and inconsistencies than most. However, in the end, we are just human, like everyone else, and we retreat to our own families at the end of the day. Over the last 17 years of practicing psychotherapy, I've come to realize there are no new problems. This is not to minimize the problems that exist, but to suggest that humans are human, and as different as we are all remarkably similar. Therapy is not mystical. Problems, although deeply painful for the individual, are not new. Each of us experiences waves of sadness, grief, excitement, despair, joy, anger, frustration, and euphoria. It is the essence of the human experience. There's a certain strength in asking for help. Neglecting to help seek is not indication of superb inner fortitude. It could be stubbornness or a conditioned sense of self-sufficiency, or perhaps a sophisticated and ultimately believable defense mechanism, but rarely is it a sign of strength. Before considering or bowing away from therapy completely, please consider the following. Therapists will not call you crazy. This is not a term we use, and it is dismissive, uninformed, and flippant way of regarding a person and or his or her problems. We respect you more than that. We don't sit around and talk about you over lunch or with our families. We deeply value confidentiality. Many of us are playful and funny. Therapy does not have to be serious all the times, and in fact, humor can be one of the best ways of working with a person. Laughing really is good medicine. And if I can get you to laugh, if we can find things to laugh, then we'll do that. You cannot shock us. As uncomfortable as it may be to share something deeply personal, we've likely heard it before and are well prepared for any disclosures you make. Remember, there are no new problems. If it's out there, we've likely heard it. You're not going to surprise us, and we're not going to judge you because of it. Most of us have been or are in therapy ourselves. Problems and pain do not discriminate. Pain is universal. Do not assume others do not struggle. They do. Christians and atheists, doctors and lawyers, teachers, students, rich and poor, black and white, married and single, thick and thin, pastors and plumbers, new mothers, newly retired. We all struggle. Therapists see versions of the same problems over and over. Infidelity, substance abuse, anxiety and depression, sexual abuse or assault, work-life problems, low self-esteem, comparison to others, marriage problems, spiritual wounds, grief, fertility issues, parenting and family problems, disordered eating, domestic violence, family of origin issues, setting boundaries in relationships, burnout, sex and pleasure, racism, sexual orientation. Remember, there are no new problems. Therapists care deeply about their clients. That's why we chose to do what we do. With that said, we're all different. We have different personalities and styles. The most important part of creating a successful therapy experience is the relationship between the therapist and the client. It's okay to shop around until you find the right therapist. And lastly, don't knock it until you try it. Many skeptical people have acquired a deep appreciation for the therapy process. And in fact, some of my favorite people to work with are the ones who come in and they are skeptical. I worked at Fort Riley for 6 years with soldiers in the Army Substance Abuse Program, which is where Mick and I met each other. And most of these young people didn't want to be in there. And there's a certain art and strategy and kind of convincing them that this is a good process. And there's no greater joy than seeing someone, whether it's a young soldier or someone in the civilian sector, say, oh, this wasn't so bad. In fact, I will often challenge people who have a resistant spouse or a resistant child. I say, give me one session with them. And this isn't necessarily a testament to me, but just give me one session with them. I bet I can get them to come back a second time. And usually we do. And usually what I hear, I'm sure Mick and Heather have heard something similar, is, oh. In fact, I've heard this a lot. Oh, that is not what I thought it was going to be. I said, well, good. I don't know what you thought, but I'm glad it's not what you expected. And they usually mean that in a positive way. We've got about 10 minutes. I'm not sure I want to go into this next part. I think what I want you to know, therapists, when we say we care deeply about the people that we work with, we care deeply about the people that we work with. We see a lot of ourselves in every person we meet, in one way or another, right? Because we're all human. We've got this thing connecting us, this human experience. And so we may come from very different places, but there's always overlap. A good therapist is not going to judge you. They're not going to shame you. They're not going to make you feel bad for coming into therapy. They're not going to make you feel bad because you've struggled. You may be struggling with something that you think is completely out there and off the wall. Don't let that stop you from getting help. We've seen it, we've heard it. We want to see people get well. That's why we do what we do. Okay, what to do in a crisis. I don't know how much of this I'm going to go into necessarily. I do want to, make sure that this is up here. Some of you may be aware of the Crisis Stabilization Unit, the Pawnee Crisis Stabilization Unit. I told you I have lots I could go into, and I'm running out of time. If someone is at risk to themselves, you've heard that saying, I'd rather have them mad than dead. Like, if somebody is struggling, if you know they're struggling, if you think they're struggling, they've given indications of wanting to hurt themselves, if they're giving away possessions, if they're talking about hopelessness, if they're isolating, try to get them help. Things you can do, I'll just run through these real quick. We've got about 7 minutes here. Things you can do if you know, like if it has become clear to you that someone you love, a spouse, a partner, a child, a parent, a sibling, a coworker, if you recognize that someone is really struggling, these are some things that you can do if you know they're in a crisis. First, be present. Be present and be non-judgmental, okay? There's value in just being there. Don't offer advice. I'm telling you right now. Aside from understanding mental health, please walk away with that. Don't try to give advice. People think therapists give advice all the time. We don't. Okay? Don't say you should be doing this. You should try this. Why don't you do this? It's not helpful. So be there. Be present. Be a non-judgmental ear. Listen to them. Encourage them to stay connected. Encourage those 6 things that we went over. Okay, I'm hoping those are going to be programmed in a little bit. Check in with those. If you need to drive them somewhere, if you need to help with kids, do something practical. Here's what you shouldn't do. Don't assume you know what they're thinking. You may have similar experiences, but their experience is going to be different. So don't assume you know what they're thinking or you know how they're feeling. Don't tell them don't tell them that they are lying or exaggerating. Don't use dismissive comments like, it's not that bad. It could be worse. People have it so much worse than this. This will pass, right? Those are often well-intended comments, but they're really dismissive. Avoid making them do what you say, like you should do this, you should do this. Obviously, avoid putting yourself in any situation where you might be harmed. Obviously, faith-based communities are a good place. And I will, even for my non-believing clients, I will often say, especially if they're socially isolated, just go to church. You don't have to believe anything they're saying. I don't care. Just go, because you know what's at church? People. And you know what we need? People. And so I'll say go to church. Just sit there, say hi to someone, or wait for someone to say hi to you, but just go because we need people. All of us do. Barry said this morning in the sermon that we're created to be in connection with other people, and we are. Right? And so if you know someone is in crisis, you may have to be that person. Now, if they're making suicidal gestures, please get them to Pawnee or call 911. Okay, I would rather have them be really angry with you because you called them on it than to be in a hospital on a ventilator or dead. So you call 911. We're a few minutes early, which I didn't expect, but I guess we can just give a little bit longer break. How do you want to do that, Barry?
We're going to go ahead and just go into a question answer time. So thank you very much. It's text your question to 888-976-9220.
Well, I think we'll resume. So we've had a number of questions that have come in from either here in person or online, and so this should be fun because I don't know what they are, and Heather Click, who is one of the therapists at Andrews and Associates, is going to go through some of those, as many as we can get through in 30 minutes. And I will do my best not to mess them up. For an anxious person, I don't know that this is a real great idea, but...
Okay, here's our first question. As a teacher, what's one of the best things I can do for a student with a mental illness?
Boy, we were just talking about this. There are a lot of kids right now who are struggling, who maybe weren't struggling before, but who are struggling, particularly in response to COVID. I think, understand empathy, patience, I think there are going to be some kids, because of where they're at, especially if you've got an anxious kid who's going to they may need more time to complete an assignment. They may need a quiet space to think. They may need opportunities to touch base one-on-one, but without being called out by the teachers so they feel like they're different or weird or something like that. Keeping things as routine and normal, obviously. I think that's for parents and teachers, keeping things very structured for the kids so they know what to expect. Checking in with them. It's okay to ask, how are you? Find out where they're at. Get a sense of their feelings, if they're struggling with something. Just talking. You're going to hear me say over and over that there's so much value in just being an empathetic, compassionate presence for someone, and I think for teachers, it's no different. So, connect with the kids. Connect with the kids. I won't go off anymore on that. Okay, because I'm thinking about our poor teachers too, who we know are struggling.
What if you know you want therapy, but you can't afford it?
Okay, this is a really good question. Therapy can be expensive. It can be really expensive. And if you're paying out of pocket, so if you have no insurance, most people will try to use insurance to offset the therapy cost. If you don't have insurance, an outpatient therapy session can run anywhere from $100 to $160, $170. Most of us don't have that kind of money, right? And then what that means is it makes mental health a luxury and something only those who can afford it can afford. So there are some options. One would be the K-State Family Center. So the K-State Family Center is, of course, it's on campus. It's where the marriage and family therapy students study and practice therapy, and they offer reduced fee sessions. And so it's always a good option. They base it on family size and income, and so sessions could be as low as $5. Okay, so it's a good place to go for low-cost therapy. All the students there are under heavy supervision, so you actually get the benefit of a new student therapist plus the faculty member or the doctoral student who's supervising them. So it's kind of like a twofer. So that is a good option. I know at Andrews and Associates, and this isn't necessarily a plug for Andrews, except that one of the things that we have become aware of is just this, that there is a need for access to care and making sure that everybody has access regardless of their financial status. And so at least at our office, we're bringing on interns. And again, these are student interns. They're studying at a number of different universities, quite literally across the country. But we've got 3 of them now, and they're all offering free sessions. And so it allows individuals to get good access to care at no cost, and then it allows these students to get the hours that they need to graduate. And so K-State Family Center, look for organizations like Andrews or others who are offering interns who can offer either reduced fee or pro bono therapy sessions.
Can you go over the difference between depression and anxiety?
This is all of next week, but I will give you in short kind of what it is. Depression and anxiety are the two most common mental health conditions, and they're like sisters, and so they often hang out. So if you're prone to one, you may also be prone to the other, and they're comorbid, which is the word that we use to say that they hang out together. So unfortunately, they like each other. So in short, because again, next week is a really deep dive into both of these, so I would encourage you to come back. Anxiety is going to be marked by excessive worry, restlessness, a fear of something bad, right? So anxiety is all based in the future. It's a fear of what if. What if this happens? You can't stop worrying, you're restless, you might, most people who are anxious will feel it right through here. And so if you're anxious, you know exactly what I'm talking about. You're gonna feel it somewhere in the pit of your stomach, up to your chest, so there's a very somatic component to it. Often you can't turn your head off. Anxiety will spin people up, meaning they might be really busybodies, right? And so the other day my daughter said, "Is there a reason you're frantically cleaning?" I'm like, "No." "Yes, I'm anxious." And so I was frantically cleaning, but it will spin people up like that. And so they may have difficulty resting, sitting down, not doing anything. But mostly it's gonna be that excessive worry and nervousness. Depression is gonna be marked primarily by a low mood that lasts 2 weeks or longer. It's gonna be marked by decreased interest in things that were once enjoyable. And so this is where we start seeing things like anhedonia, which is just the loss of pleasure. And so it may not even be sadness necessarily, it could just be, I don't enjoy anything. I used to enjoy spending time with my kids, I don't enjoy that anymore. Depression can come with a lot of hopelessness, isolation, social isolation, but it's going to be marked primarily by the low mood, loss of interest in things. Anxiety is going to be primarily the nervousness and the excessive worry. That's a very short explanation of the two.
How do you help someone dealing with label avoidance stigma?
Just do it. Meet with a therapist. Meet with a therapist. I think, you know what, and again, this is why I was sharing that it's almost fun to turn someone, right? Someone who comes in and are really apprehensive and they have all the stigmas that they're bringing with them and they don't want to be there, and then they leave and they're like, oh, that wasn't that bad. All right, the best thing I can say is just do it. Do your research, find a therapist who specializes in the areas that you're struggling with, read their bios. You can go on either, you know, like if it's a group, you can find the group website and read bios there. If you go to psychologytoday.com, you can filter through therapists there and you'll see their headshot, you'll see a description of the insurance that they accept, the issues that they specialize in, a little bit about their approach. So find someone that you feel fits well with you and then just do it. And this is where I would say, suck it up, buttercup, just go do it. Try it once, right? Like, try it once. If you try it once and it's a flop, okay, but otherwise just try it. And this is why, you know, I think it's important that people understand that we are just people. There's nothing special about us except what we studied. And that there are, you know, if there's anything you learn being on this side of the couch or the chair or the room where you're in the helper role, we see everyone, right? Like we see the professors from K-State who come in, or the doctors or the lawyers. We see people who are really well educated. We see affluent people. We see stay-at-home moms who come in and are struggling. We see the farmers. Like, there is no person that we don't see, right? So I think most of us have this belief that everybody else's lives are okay, or because somebody's achieved a certain level of whatever, that their private lives are healthy and intact, and that's not always the case. And so do your research and then try it. Just try it.
How do you socialize when anxiety seems to be constant and debilitating?
Social anxiety is a really common, one of the more common anxiety disorders, and it's one of the few that affects men and women equally. And so social anxiety would be this fear of going into a situation where there are lots of people, and it's usually attached to some fear of being judged. So I'm afraid I'm going to look stupid, I'm going to say something stupid, they're going to think this way about me. And so usually what I would say is find a situation that is mostly safe, that you know the people well. When you get there, find an ally. Find one person, and then stick with that one person. And so maybe it's, you've got something in common with that one person, and you just stick with them. You find a safe person. Unfortunately, things like social anxiety can be helped through medication. It can also be helped through what we call just exposure therapy. Not really therapy, but just doing it. And again, that's the hard part. So have a person that you can go with, or once you get there, attach yourself to that person, right? Have a conversation with that person. When you arrive at a social gathering of some sort, maybe take your time just to assess the space and the people instead of jumping right in. Usually if you've got social anxiety, you're probably going to want to go with someone. Honestly, you're going to want to have a safe person there with you, a friend or a family member or someone. Just so it's like a safety net, right? Like you've got a safe person if you're going. And again, I say I'm not a pill pusher, but I've had a lot of clients who have had debilitating anxiety, like where they just can't come to church on Sunday, they can't walk into a classroom, they can't work in groups at work because of this anxiety. They've done very well on medication. And then the other thing I'll say is, if you're working with me, we're always going to tweeze apart introversion and social anxiety. That I would love to give a whole talk on that, because there are a lot of introverted people who really are just introverted. They're not necessarily socially anxious, they're just introverted, and they just don't like crowds. That doesn't mean there's anything wrong with them. And so we will always tweeze those two apart. So we would run through and say, okay, if you're introverted, these are the qualities that you're going to possess. Totally normal, very healthy, nothing wrong with it. Once we tweeze all of that out, what is left? Are you still socially anxious, or are you just an introvert who's trying to pretend to be an extrovert? Okay, again, that's a whole nother training, but we always tweeze those two apart.
Okay, how do you determine excessive anxiety from just normal anxiety?
Okay, so there's what we call state anxiety. State anxiety is the anxiety any one of us feel before a big event, or so you might feel state anxiety before a big race, or before giving a presentation or an interview or taking a test. State anxiety is normal. Every one of us is going to experience that kind of anxiety. That's part of the human condition. If you feel that way more days than not, then you probably have something that's more generalized in nature. State anxiety is transient. It comes and it goes. So it will pass after the event. Okay, so you have a big test, you're feeling anxious before it, you take the test, generally the anxiety will pass. But if you are spending most of your days feeling some level of anxiety, okay, you may not recognize it as being excessive because you've always been that way, right? So like if you have a form of anxiety, the generalized version of anxiety, I don't know any different. In fact, if I'm not feeling anxious, then I worry about what I'm not being anxious about, right? And so it's like there's a void if I'm not anxious. And so state anxiety, transient, it's going to pass. Excessive, you're feeling it much of the time. You're feeling it when there really is no specific trigger for it. You might just feel this kind of underlying hum of anxiety all the time. Restlessness, uneasiness, nervousness, a sense of doom or gloom. It sounds bizarre, but if you've lived it, you know it. It's just this overwhelming fear all the time. That's not normal. It's not normal to be anxious all the time. If you're anxious all the time, then it's probably excessive. If you're anxious more days than not, it's excessive.
How do you help somebody in a detrimental cycle hurting their mental health when they've tried therapy but felt that it was unsuccessful?
There have been a lot. That's a good question. Just as there are a lot of really great therapists out there, there are also therapists that maybe aren't so great. And I have had clients, and I know I'm not alone, who have come out of other therapy experiences that have been more hurtful than helpful because of some of the things that we talked about and some of the stigmas or the stereotypes or the help yourself. Some of those messages get conveyed to the patient. Dang, that is a really good question. Try again. Try again, and that means you would have to do it scared. Like if you've been hurt, if you've tried therapy, it hasn't helped, you've been hurt by a therapist, you've been hurt by the process of therapy, you feel like you've gotten worse through the process of therapy, you weren't meeting with the right person. I mean, bottom line, you weren't with the right person. And so try again. And again, do your research, and then do it scared. And it is 100% okay to walk into a therapy appointment with a new therapist and say, listen, I'm pretty skeptical. I've been hurt by this process. I'm going to stay pretty guarded until I know I can trust you. That's totally okay. And so do your research. Try again. Do it scared. But don't give up. Just don't give up. And sometimes it does take shop. This is why I said shop around. You have to find the right person.
Am I wasting my therapist's time if I don't have anything to discuss, but I'm scheduled to go?
Okay, so therapists are divided on this, okay? In my opinion, no. And so I say therapists are divided because there tends to be two camps of therapists. There's the one I consider myself highly relational, so it's very much about the relationship and having ongoing long-term relationships with the people that I meet with. And I recognize that maybe there's not a crisis or a major event or something that has to be worked through, but there is value in coming. If for no other reason, then I can be a safe person throughout the course of a week to talk to. Okay, so if you are someone who values that, then you need to find a relational therapist. There's another camp of therapists, and again, neither is necessarily right or wrong, we're just different, who are what we call very solution-focused and tend to operate more they do more short-term therapy. And again, there's a place for that too. And these are therapists who like to set very concrete goals, and they're gonna work with you until you get to a place that you've accomplished those. And then once you've accomplished them, they'll go ahead and graduate you out of therapy. Neither is right or wrong. And this is where finding the therapist fit is important. Right, so there's a number of us who will do very long-term therapy, and value that. And the clients the clients who stick around for long-term therapy are finding value in it. I promise you, if we ever get to where we're like, what are we doing? We're going to tell you, right? Like we're going to say, listen, I don't know that you need to be coming in here anymore, but it will always be a conversation between the therapist and the client. So no, you're not wasting their time. If they're a relational therapist, you're not wasting their time.
So with therapists being very busy right now, how do you shop around?
Get your name on a waiting list. Therapists are busy, and it's not just us. This is across the board in Manhattan and Junction City, and wherever you go. Because the need for mental health services has increased so much, we are busy. And most of us will have some version of a wait list, which is unfortunate. And I know that everybody's working as fast and hard as they can to accommodate. Obviously, if we have somebody calling in who's what we'd call high acuity or high risk, we're going to get them scheduled, right? So we'll manufacture time to make sure that person can get seen. Otherwise, most places right now have a waiting list. What was the question again?
How do you shop around when therapists are so busy and you can't get in?
You maybe put your name on multiple waiting lists. I know at Andrews, we've got people who are on our waiting list and other waiting lists, right? Just so that as soon as something opens up, they can find a spot. That's probably the best. Keep in mind, there are the larger groups like what we have, and there are a lot of really good individual providers tucked away in our community that maybe don't have large practices or big fancy offices, but they're out there and they're good. And sometimes it's just a matter of like getting on Psychology Today or asking around to find those people, because they are out there, they're kind of tucked away, but they're really good providers. So ask around, get on multiple waiting lists if you need to, just so that you've got your name in there. People are moving up. We're always moving them up and getting them in as fast as we possibly can. So if you're on multiple waiting lists at multiple places that you think might be a good fit, you'll increase your chance of getting in sooner. If it's high risk, high acuity, at least our office will get you in right away, because we're not going to let anyone hang out there who might be suicidal or at risk of hurting themselves or in some kind of major crisis.
What do I do if I'm starting to feel overwhelmed with our crazy fast lifestyle and most of the busyness is due to work and school, which are essential things? How do you draw the line?
How many can identify with that? I struggle with this because I think this describes a lot of us, including myself. We have things that are just, that you have to do them to live. Well, let me preface this by saying that at least in our culture, we live in a culture of busyness. Not every other culture runs as hard and fast as we do. And so things that we feel are necessary sometimes aren't. We're a culture based on productivity and achievement and extroversion, which means all these social connections and events, and we don't want our kids to be left behind, and so we get them in all kinds of activities, and I am not shaming any parent out there who has done that. We've done it. But we are just a culture of busyness, and because most of us don't know any other culture, this is all we know. We know how to run hard and run fast and stay busy all of the time. At some point, we have to stop wearing that busyness as a badge of honor, right? We have to stop walking around saying, oh, I'm so busy, I'm so busy, I'm so busy, I'm so busy. I got all these things going on. It's not a badge of honor. We have to take responsibility for our own time, because if I've learned anything, and I know these things are necessary, trust me, I do. I work and I've got kids and we do the whole balance thing as well. But at some point, we have to set boundaries. We have to set boundaries. And if I've learned anything, it's that nobody's going to do it for you. There's nobody who's going to come in and set boundaries for you. There's nobody who's going to come in and say no for you. You have to do that on your own. And so when you're trying to balance school and work with kids, maybe it's we only do so many activities. Maybe it's we rely on the village, right? And so we let the kids go with, especially if you're doing traveling sports or something, we're going to do this parenting thing where the kids are going to go here with this family, and that way we can stay home and take care of the house. Maybe it's drawing very clear boundaries at night and just leaving some nights open, right? We overschedule. I don't know why we do this, but we do it all the time. We overschedule ourselves. We overcommit. So just saying no, we're not going to do this. No is okay. No is probably the best boundary you can learn to set. If you are raising children, please teach them how to say no. Because most of us adults never learned how to do that. And so we just keep saying yes to everything. So set boundaries around your evening routine, put the phones away, have regular bedtimes, say no to extracurriculars. It is okay, your children will survive. They can grow up to be fine human beings if they're not in everything. Again, I'm not shaming anyone because as parents, we've done this battle too, where we want them to be in everything, but we've also understand the value of rest and teaching them how to rest and take naps and chill out and enjoy friends and that sort of thing. Work is work for a reason, right? It's going to be there. I promise what you don't get done today is going to be there tomorrow. Like it or not, it will still be there, right? Whatever email you didn't get to is going to be there tomorrow. It's all going to be there. So you might as well wrap it up and go home. And those are boundaries. I will often talk with people about this urgent importance matrix. right? Because we are so busy so if you imagine urgency on one axis and importance on the other, then we tend to the things that are urgent and important, and if it's not there, then I guess we wait until they get there. I don't know. Everything will eventually become urgent or important if it's urgent and important. And so we can't deal with everything, but if you can focus on those things that need your attention now, that are more urgent, and you just focus there and you let those other 3 quadrants go, then now the downside of that is sometimes you feel like you're just barely keeping your nose above water because you're just always attending to urgent things. But you can't do it all. And sometimes the emails that come in may feel urgent, or they might feel important, but they might not be the other. So if you leave them in your inbox until the next morning, it will be okay, right? And so it's, unfortunately, there are requirements for work, there are requirements for school, but most of us are not doing as good a job as we could with managing our own boundaries and our own time. It's a balance, it's hard. I think if you've raised children and you've worked, you've probably been here trying to figure all of this out at some point.
One more question.
Yep.
What's the difference between Celebrate Recovery and therapy?
That's a really good question. So in Celebrate Recovery, it is very helpful. Okay, it's very helpful. It's very helpful in working on relationships, and one of the things we have problems with in life in general is relationships. We have problems with boundaries. We have all kinds of issues going on with that. And when you're working on developing a relationship with Christ and getting closer to Christ, one of the outcomes of doing those sorts of things is that we are able to, in that process, work on our other relationships as well. That can be somewhat therapeutic, but it's not therapy. I need to be really clear about that, because Celebrate Recovery is a ministry about getting and improving and having a relationship with Christ. It is not therapy, but I can't say that there's not some therapeutic value in doing those things. So think about, early on, and a couple of times, one of the things you heard was, when people are Christians or they have a belief system, are not their relationships, marriages better overall? Well, the answer is they are. I think it's like folks that have, Christians and have faith-based, those folks, the divorce rate, instead of being 50%, is something like 95% are successful. And when you look at the number of people that do better overall in life as far as dealing with depression and dealing with anxiety, when they have that faith base behind them, when they have that belief in Christ, when they have those kinds of things going on, they just do better overall. So that's not arguable necessarily, but that's a very good question. But the main thing is therapy, and Celebrate Recovery is working on a relationship with Christ. Does that help?
That's good.
Thank you.
All right, we have 1 minute. Give one last one with a fast answer. I don't want to waste it.
Okay, well, the pressure's on. So what are your thoughts on people who are maybe in a good place and wanting to seek therapy as more of a preventative?
Do it. Is that short enough? Do it. And it's like for relationships, we're in a culture too where everything is like, let's respond once there's a problem, and not so much let's prevent the problems from developing in the first place. So do it. Now there are some implications there with insurance and stuff. I'm not going to go into that, but if you want to stay mentally healthy, then you do the things along the way to keep yourself healthy. If you want a healthy marriage, you do the things along the way to keep yourself healthy, right? We call it enrichment counseling. It's do it.
I like that. That was right to the point. Just do it. All right. And so, hey, I want to just say, would you just help me by saying thank you? It's so important that we press into issues like this, because if you just ignore your mental health, your emotional health, your spiritual health doesn't just go away. It's there, and then unhealth seeps in. It can start to get bad, and it can start to become what might have been a simple problem to have talked to someone in therapy about, what might have been a simple problem to go to Celebrate Recovery and get a little help. all of a sudden becomes a much more major issue because you go, no, 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 I don't know, no, and then it bubbles over. And I've seen that kind of happen as a pastor, and that's a dangerous thing. So, hey, we're going to be back next week. We're going to do more of a deep dive into anxiety and depression. We're going to get into some specifics. We're going to have some more question-answer time. I know numerous questions were not able to be answered today, but we're going to have more time this next week. So let me close this in prayer. God, thank you so very much for all that you do in our lives. I ask that you just continue to work and that you would continue to minister and to help people get out of whatever rut or struggle or hurt or pain that they're in. And Father, that you would help them to just fully be who you've designed them to be. God, I thank you for the mental health professionals all around our community. I thank you so much for those who are striving to bring some sense of normalcy and joy and hope to people who are hurting. And so, God, I just pray that in the midst of that, you would lift them up as they continue to lift others up. Lord, we thank you for all that you do. It's in the name of Jesus we pray. Amen. God bless you guys.